Hello everybody, I'm Dr. Mike Blaney, a general and bariatric surgeon at Live Healthy MD in Augusta, Georgia. And today in our video series we're going to talk about the sleeve gastrectomy. Sleeve gastrectomy is one of the more commonly performed bariatric or weight loss surgery procedures that are being done currently in 2019. Surgeons began experimenting with this operation as a weight loss surgery procedure in the mid-2000s and became routinely covered by insurance companies around 2010. Procedure really is, from a technical point of view, is rather basic. When I'm talking to my patients about the various different operations, I'll routinely say, if we look at a picture of a sleeve gastrectomy and a gastric bypass, most individuals will look at the diagrams of these operations and automatically assume that the sleeve gastrectomy must be simpler, safer, and therefore a better operation. But I really encourage patients to learn about all the procedures, because all of the operations that we do in the field of weight loss surgery are relatively the same in terms of the level of risk and complexity, levels of complications, as well as hospitalization, stays, and recovery. So when we talk about the sleeve with our patients, I'll describe it as basically we're removing about 70 to 80% of the stomach volume at the time of surgery, which of course is performed laparoscopically, meaning we place little small incisions on the abdomen and inflate the abdomen with gas while we do the operation through a TV camera. At the time of surgery, we place a tube in the stomach. The tube is about the size of an individual's thumb. And that tube is placed into the stomach along the inner curve, and the purpose of the tube is to act as a guide. And we'll use the surgical staplers that we routinely use in the field of general and bariatric surgery to staple the stomach. And we'll staple from the lower edge of the stomach all the way to the top of the stomach, and then detach the outer part of the stomach, as you can see in the diagrams that we're showing during this video. We'll remove the entire outer curve of the stomach, effectively removing about 70 to 80% of the stomach volume. What we're left with at the end of the operation is a tubular shaped stomach, or a banana shaped stomach. The tube that we use to size the stomach is of course removed at the end of the operation. An individual after surgery now has a much smaller stomach volume and will lose weight because they're eating less food. So an individual is much more fully satisfied with a small meal. Another mechanism that we believe is in play that assists with an individual's weight loss is reduced appetite or hunger. We believe that the stomach makes many different hormones. One of these is known as ghrelin, and ghrelin is believed to be a hunger hormone. By removing a large portion of the stomach volume, we're theoretically removing a large amount of the cells that make this hormone. So what I observe clinically in our patients after the operation is a significantly reduced level of hunger. Many individuals will tell me that they go all day long without ever thinking about food. Of course, over time, hunger does seem to come back, just not nearly as fully as it once was. And an individual is more fully satisfied with their small meal. We thank you for watching this video. Please don't forget to subscribe, and if you liked what you heard today, please give us a thumbs up.